Every single morning, hundreds of millions of people wake up and do the same thing within the first 20 seconds of consciousness. They roll over, grab their phone, and sit up fast. It feels completely harmless. It is completely harmless, right? Wrong. That single sequence, the grab, the jolt upright, the immediate screen, triggers a cardiovascular chain reaction that cardiologists have been tracking in the data for years. And it's not the only dangerous morning habit hiding in plain sight. The hours between 6 and 10 a.m. are, statistically, the deadliest window of the entire 24-hour cycle for your heart. Heart attacks, strokes, and sudden cardiac events are dramatically more likely to happen in the morning than at any other time of day. Not slightly more likely, dramatically. Here's what almost nobody tells you. It's not bad luck. It's biology colliding with modern behavior. And several common morning habits, things you probably did today, are pouring gasoline on that biological fire. Hi, I'm Dr. Chester. I'm an interventional cardiologist with over 16 years of clinical experience. I've performed thousands of cardiac catheterizations, managed acute MI patients in real time, and spent years studying the patterns of when and why cardiovascular events happen. And the pattern that keeps showing up, the one that genuinely alarms me, is this. A significant number of the heart attacks I see in my patients are preceded by the same cluster of morning behaviors. Behaviors that are considered completely normal. Behaviors that nobody warned them about. In this video, I'm going to walk you through exactly why your heart is physiologically vulnerable in the first 90 minutes after waking, the specific morning habits that amplify that vulnerability to dangerous levels, and a simple morning protocol grounded in peer-reviewed cardiovascular research that can meaningfully reduce your risk. I'm going to show you the research behind every single claim. No guessing, no wellness influencer nonsense. Real cardiology. And we're going to start with that 20-second mistake. Why your heart is already under stress the moment you wake up. Before we get to habits, you need to understand what's happening inside your cardiovascular system at the moment your alarm goes off. Because without this context, none of the rest will fully make sense. While you sleep, your body is in a state of relative cardiovascular rest. Your heart rate is slow. Your blood pressure is low. Your blood is in a more viscous, thicker state because you've been lying horizontal and haven't hydrated in 7 or 8 hours. Your cortisol, your primary stress hormone, has been quietly building in concentration since around 3 or 4 a.m., preparing your body to wake up. This is called the cortisol awakening response, and it produces a sharp cortisol spike in the first 30 to 45 minutes after waking. Simultaneously, your sympathetic nervous system, your fight or flight system, activates. Adrenaline surges, your heart rate climbs, your blood pressure rises sharply, sometimes 25 to 30 points systolic within the first hour of waking. Your blood platelets, the cells responsible for clotting, become more sticky and aggregation prone in the morning than at any other time of day. This combination, thick blood, surging blood pressure, sticky platelets, spiking adrenaline, creates what cardiologists call a prothrombotic state, a state in which your cardiovascular system is primed for clot formation. A published study in the journal Circulation confirmed that the risk of a major cardiac event is 40% higher in the first 3 hours after waking than at any other time. The ISAM study, analyzing over 4,000 myocardial infarction patients, found that 28% of all heart attacks occurred between 6 and 12 a.m. The biology is not subtle. Now here's the critical point. That baseline morning vulnerability is baked in. You can't eliminate it. But what you can do is stop layering dangerous habits on top of it. Because that is exactly what most people do every single morning without realizing it. The 20-second mistake. The alarm, grab, and bolt. Let's talk about the specific behavior I mentioned at the top. You hear your alarm. Within seconds, sometimes within 2 or 3 seconds, you reach over, grab your phone, and sit or stand up abruptly. Maybe you immediately start checking notifications. Maybe you hit snooze twice, and then bolt upright with a jolt of low-grade panic about being late. Here's what that does physiologically. When you move from horizontal to vertical rapidly, your blood, which has been pooling evenly while you slept, suddenly needs to be redistributed upward against gravity. Your heart has to compensate instantly. For a healthy 25-year-old, this is trivial. For anyone over 40, anyone with early-stage arterial stiffness, which, by the way, begins silently well before any symptoms, anyone with even borderline hypertension, this orthostatic shift is a genuine cardiovascular stressor. A study published in the Journal of the American College of Cardiology found that orthostatic hypotension, the blood pressure drop that occurs when standing rapidly, is associated with a 54% increased risk of heart failure and a 58% increased risk of coronary artery disease over time. That's not a small signal. And then you add the phone. Within seconds of waking, you're reading emails, scrolling news, checking messages. Your brain, which is still transitioning out of sleep, now receives threat signals: a stressful email, a negative headline, an unanswered message. And your amygdala, your brain's threat detection center, fires. Cortisol and adrenaline spike further, on top of the cortisol awakening response that was already climbing. Your blood pressure, which was already rising from the act of waking, gets a second, third, fourth push upward in rapid succession. Research from the University of California found that morning smartphone use within the first 10 minutes of waking was associated with significantly elevated cortisol levels throughout the entire day, not just in the morning. The morning cortisol spike sets the hormonal tone for the next 16 waking hours. When you weaponize it with immediate stress-triggering content, you are not just having a bad morning. You are running your cardiovascular system at a higher stress baseline for the rest of the day. The fix is deceptively simple, and I'll give you the exact protocol at the end of this video. But first, let's cover the other morning habits that are quietly stacking cardiovascular risk. Morning habit number 2, drinking coffee first, water never. The majority of people in the Western world wake up and within 15 to 20 minutes drink coffee. Not water first, coffee first. This is such a normalized behavior that questioning it sounds almost absurd. But from a cardiovascular standpoint, it deserves serious attention. After 7 to 8 hours without fluid intake, you wake up in a mild state of dehydration. Your blood volume is slightly lower than it will be after you rehydrate. Your blood viscosity, its thickness, is at its daily peak. Thicker blood flows with greater resistance through your arteries, which means your heart has to work harder to push it through, which means your blood pressure climbs higher. Now, caffeine is a vasopressor. It constricts blood vessels and elevates blood pressure. A study published in the American Journal of Clinical Nutrition found that caffeine consumption increases systolic blood pressure by an average of 8 millimeters of mercury and diastolic pressure by 6 millimeters of mercury. In healthy individuals who are well hydrated, this is typically manageable. In a mildly dehydrated person whose blood is already thick, whose blood pressure is already surging as part of the morning cortisol response, caffeine is adding a third layer of blood pressure elevation on top of an already challenged cardiovascular system. I'm not telling you to give up coffee. The research on moderate coffee consumption and long-term cardiovascular outcomes is actually fairly positive. The issue is sequencing and timing. Drinking coffee before water on an empty stomach during your peak morning blood pressure window is a behavior pattern that unnecessarily amplifies cardiovascular strain. The research-backed adjustment is straightforward. Drink 16 ounces of water first, before anything else, before coffee, before food. A study in the Journal of Clinical Endocrinology and Metabolism found that drinking 500 ml of water increased metabolic rate by 30% within 10 minutes and had measurable effects on sympathetic nervous system activation. Hydrating first reduces blood viscosity, begins to normalize blood pressure, and buffers the cortisol spike before you add caffeine to the mix. Wait 20 to 30 minutes after waking before your first cup of coffee. This timing specifically avoids the peak cortisol window between roughly 30 and 45 minutes post-waking, when your body's natural cortisol is already at its highest. Drinking caffeine during this window doesn't add much alertness. Your cortisol is already doing that job. But it does add blood pressure strain on top of an already elevated baseline. Drinking it slightly after that window gives you more of the alertness benefit with less of the cardiovascular cost. Morning habit number 3, skipping or delaying breakfast in the wrong way. There's enormous confusion about intermittent fasting and morning eating, and I want to be precise here because the nuance matters. Extended overnight fasting can be beneficial for metabolic health. This is well documented. But a specific pattern that I see commonly in my practice is dangerous in a different way. People who skip breakfast entirely, skip water, drink coffee on an empty stomach, and then exercise intensely, all before 8 a.m. This is not intermittent fasting. This is stacking 3 additional cardiovascular stressors on top of an already vulnerable morning window. When you exercise intensely in a fasted, dehydrated, high cortisol state, your body releases a surge of catecholamines, adrenaline and noradrenaline, that are already elevated from the morning wake cycle. A study published in the European Heart Journal found that heavy physical exertion in the morning was associated with a higher rate of plaque rupture events compared to the same exercise performed in the afternoon or evening. The mechanism is the prothrombotic morning state we already discussed: thick blood, sticky platelets, and elevated vascular resistance meeting intense cardiac demand. This doesn't mean don't exercise in the morning. Exercise is one of the most powerful long-term cardiovascular protections that exists. What it means is, hydrate before you train. Consider a small amount of easily digestible carbohydrate before high-intensity morning sessions. Give your body 15 to 20 minutes of gentle movement before jumping into peak intensity. Let the cardiovascular system ease into load, rather than slamming it from 0 to maximum during the most vulnerable window of the day. If you practice true intermittent fasting, eating within a specific window later in the day, that's a different conversation, and that protocol can be heart-healthy when done correctly. The dangerous version is unconscious, reactive fasting. Not eating in the morning because you're rushed, drinking coffee instead, and then demanding peak physical output from a cardiovascular system that is already under significant biological stress. Morning habit number 4, temperature shock. This one surprises people, but the cardiovascular data on extreme temperature transitions in the morning is real and worth knowing. Stepping directly from a warm bed into a very cold shower, or stepping outside into cold winter air without adequate warm-up, triggers something called the cold pressor response. Your peripheral blood vessels constrict sharply in response to cold. Peripheral resistance. The resistance your heart has to pump against spikes dramatically. Blood pressure can jump 20 or even 30 points within seconds. Your heart rate surges. For most healthy young people, the cold pressor response is tolerable and even stimulating. But research published in Hypertension, the Journal of the American Heart Association, found that cold exposure in the morning hours is a significant trigger for cardiovascular events in people over 50, people with existing hypertension, and people with known or unknown coronary artery disease. The Osaka Health Survey found that morning cold exposure was associated with a 12% increase in cardiovascular event risk in vulnerable populations during winter months. Cold showers have wellness benefits. Cold exposure training has a legitimate research base. But the key distinction is context and transition. Going from deep sleep to a cortisol surge to a rapid upright movement to coffee on an empty stomach to a cold shock. Each of those transitions is a cardiovascular demand stacked on top of the last one. When you understand the morning as a sequence of biological transitions rather than a random series of habits, you start to see why certain combinations are riskier than any single habit alone. If you use cold exposure therapeutically, consider a brief warm shower transition first, then cold. Let your cardiovascular system step up gradually. Ease into the demand rather than ambushing your heart with it. Morning habit number 5, ignoring the warning signs. This last habit is perhaps the most dangerous of all, because it's not a behavior you do, it's a behavior you don't do. And I've seen it cost people their lives. In my years of clinical practice, I've spoken with dozens of patients after surviving a heart attack who told me the same thing. They had symptoms that morning. Symptoms they dismissed. Unusual fatigue. A vague pressure in the chest they attributed to anxiety or indigestion. Jaw tightness they thought was dental pain. Left arm heaviness they assumed was from sleeping on it wrong. Shortness of breath walking to the kitchen they attributed to being out of shape. The classic Hollywood heart attack, clutching your chest and collapsing dramatically, represents only a fraction of actual myocardial infarctions. The majority are slower, subtler, and far easier to rationalize away. A landmark study in Circulation found that over 50% of heart attack patients had prodromal symptoms, warning signs, in the days or weeks before their event, that they either didn't recognize or actively ignored. The morning is when these symptoms most commonly appear, precisely because of the cardiovascular pressure described throughout this video. Your heart is under the most strain in the morning. If something is wrong, that's when it's most likely to announce itself. And if you're rushing through your morning, head down in your phone, running on no water and too much caffeine, tuned out from your body, you will miss it. This is not a call to panic every time you feel mildly tired in the morning, but it is a call to spend 60 seconds during your morning routine doing a genuine body check. Not on your phone, not while making coffee, just 60 seconds of attention to how you actually feel. Unusual chest discomfort, unexplained breathlessness, jaw, neck, shoulder, or arm discomfort with no clear cause. A sense of impending doom, which sounds dramatic but is a well-documented symptom that patients describe. If any of these appear, do not wait to see if they pass. Call emergency services. In the case of a myocardial infarction, every minute of delayed treatment results in measurable muscle death. The phrase, "time is muscle," in cardiology is not metaphor. It's biochemistry. The morning protocol that actually protects your heart. Now let me give you the concrete, research-backed morning protocol that addresses everything we've discussed. This takes under 15 minutes and requires no special equipment, no supplements, and no dramatic lifestyle overhaul. Step 1. Slow your wake-up transition. When your alarm goes off, don't grab your phone. Don't sit up immediately. Take 30 to 60 seconds lying still. Breathe slowly and deliberately. 3 to 5 deep breaths activate your parasympathetic nervous system, your rest and digest system, which gently counters the sympathetic surge of waking. This is not wellness theater. A study in the Journal of Hypertension found that controlled morning breathing for 60 seconds post-waking produced measurable reductions in morning blood pressure spikes. Then sit up slowly, feet on the floor. Sit at the edge of the bed for 20 to 30 seconds before standing. This gives your cardiovascular system time to adjust to orthostatic change rather than demanding instant compensation. Step 2. Water before anything else. 16 ounces, roughly 500 milliliters, before coffee, before food, before your phone. Room temperature or slightly warm is fine. Cold water on an empty stomach in the morning can itself trigger a mild cold pressor response. Keep a glass on your nightstand so there's zero friction to doing this. Make it the first physical act of every morning. Step 3. Phone-free first 10 minutes. This one has cardiovascular data behind it, as I described earlier. Your cortisol awakening response is already running. Immediately flooding your threat detection systems with email stress and news anxiety amplifies it unnecessarily. 10 minutes is not a long time. Read a physical book, look out a window, stretch, make your bed. Give your cortisol response space to do its job, energizing you for the day, without adding fuel to the fire. Step 4. Gentle movement first. Before any intense exercise, spend 5 to 10 minutes walking, stretching, or doing gentle mobility work. This serves 2 cardiovascular purposes. First, it gradually increases heart rate and blood pressure, rather than demanding sudden peak output. Second, a study published in Arteriosclerosis, Thrombosis, and Vascular Biology found that gentle morning movement reduced platelet aggregation, that morning stickiness of blood cells I mentioned, by promoting the release of natural anticoagulant factors. Your blood literally becomes less prone to dangerous clotting after even mild physical activity. Step 5. Coffee after 45 minutes, never before. Time your first cup of coffee to the post-cortisol peak window. You'll find it actually works better, more sustained alertness, less anxious edge, because you're adding caffeine's effects to a cortisol curve that's already beginning to decline, rather than stacking it on top of the peak. Step 6. 60-second body check. Somewhere in your morning routine, during your water, during your gentle movement, in the shower, take 60 seconds of genuine attention to how your body feels. Not anxious scanning, calm, deliberate attention. Chest, jaw, left arm, breathing, Energy level relative to your normal baseline. You know your body better than any test. Trust that knowledge. Act on anomalies quickly. What the research tells us about morning cardiovascular risk. Let me consolidate the specific science that grounds everything in this video, because I want you to leave with this evidence clearly in hand. The ISAM study, published in the American Journal of Cardiology, analyzing over 4,000 myocardial infarction patients, found that 28% of all infarctions occurred between 6 a.m. and noon, far exceeding any other equivalent time window. The circulation study on circadian cardiovascular risk confirmed a 40% increased relative risk of major cardiac events in the 3 hours following waking. Research in the European Heart Journal documented measurable increases in platelet aggregability and blood viscosity in the morning hours, consistent with elevated thrombotic risk. The University of California data on morning smartphone use confirmed persistently elevated cortisol throughout the day following immediate morning screen exposure. And the Journal of the American College of Cardiology data linking orthostatic hypertension to long-term coronary artery disease risk has now been replicated in multiple independent cohorts. This is not a cluster of isolated findings. It is a coherent, consistent biological picture. The morning is a period of genuine cardiovascular vulnerability. It is not equally dangerous for everyone, but it is not equally safe for everyone either. And the habits that most people have assembled into their morning routines, assembled by convenience and culture, not by any awareness of cardiovascular biology, are making that vulnerable window more dangerous than it needs to be. You have enormous influence over this, not through fear, not through anxiety, through simple, sequential changes that work with your biology rather than against it. What I want you to take away: cardiovascular disease remains the leading cause of death globally. One person dies from a cardiovascular event every 33 seconds in the United States. And yet, a meaningful portion of that risk is not fixed. It's not purely genetic. It's not random. It follows patterns, morning patterns specifically. The heart attack risk concentrated in the morning hours is driven by biology. The cortisol awakening response, platelet aggregation, blood viscosity, sympathetic nervous system activation, and blood pressure surging. These are processes happening inside every adult body, every morning, regardless of fitness level or diet. But they are dramatically amplified by a set of behaviors: the phone grab, the coffee before water, the sudden movement, the cold shock, the ignored symptoms, that have become so normalized we no longer even register them as choices. They are choices, and they are choices you can change tomorrow morning. Here is your summary. 1. Move slowly from sleep to standing. 30 seconds of deep breathing, 20 seconds seated at the bed edge before rising. 2. Drink 16 ounces of water before anything else. 3. Keep your phone away for the first 10 minutes. 4. Start physical activity gently, regardless of how intense your eventual workout is. 5. Drink coffee after 45 minutes, past the cortisol peak. 6. Spend 60 seconds checking how your body actually feels. 7. If you notice unusual chest discomfort, jaw or arm pain, unexplained breathlessness, or a sense that something is wrong, act immediately. Do not rationalize it. Do not wait. Call emergency services. Your heart does not need perfection. It needs consistency, and it needs you to stop adding unnecessary strain during the window when it's already working hardest. If this information was useful to you, please share it with someone in your life who has cardiovascular risk factors, high blood pressure, a family history of heart disease, or who simply has the same morning routine as everyone else without knowing what it costs them. The research in this video is freely available, but most people will never see it unless someone they trust puts it in front of them. You can be that person for someone you care about. Subscribe for more evidence-based cardiovascular and metabolic health content. No shortcuts, no gimmicks, no noise. Just the science, clearly explained. The links to my other videos on blood pressure management and arterial health are on screen now.